Hello, family and friends. Before we begin, a quick safety note. If someone is in immediate danger, call 911 or call or text 988. Please don't wait. In 2023, millions of Americans thought seriously about suicide, and more than 49,000 people died from suicide. These aren't just numbers, they're parents, children, neighbors, and friends. The truth is, noticing the signs early and reaching out really can save a life. So, what are the warning signs? Some signals are pretty direct, like talking about wanting to die, feeling like a burden, or saying they have no reason to live. Other signs are more subtle, such as making a plan, giving away belongings, or saying quiet goodbyes. Pay attention to sudden mood changes, deep hopelessness, anger, anxiety, or even a strange calm after a storm. Changes in sleep, appetite, or increased drinking or drug use can also be red flags. And if you're worried, ask directly. Are you thinking about suicide? Asking won't plant the idea. It shows you care. So who is more at risk? Risk goes up when life pressures pile on and support feels scarce. Mental health conditions like depression, bipolar disorder, PTSD, or severe anxiety increases the risk, especially if they're not treated. And substance use adds to that risk. When both happen together, we call it a dual diagnosis, and the danger is even higher because judgment can be clouded and crises happen more often. Other risks include chronic pain, trauma, past attempts, bullying, discrimination, losing a relationship, or even being close to someone who died by suicide. It's rarely one thing. It's usually a mix of many. So what can you do right now? If someone you know is at risk, ask, are you thinking about suicide? Then listen without judgment. Be there. Stay in person or on the phone so they don't feel alone. Keep them safe. If there's risk present, limit access to firearms or medications. If danger feels urgent, call 911. You can also call 988 to build a safety plan. Help them connect. Aim for same-day support, whether that's with a doctor, therapist, counselor, crisis center, or faith leader. Follow up. A text, a call, or a visit in the days and weeks ahead to say I'm thinking of you can be life-saving. Make sure a safety plan is in place, things like warning signs, coping steps, and who to call. Through it all, support from family and friends makes a huge difference. It is important that the individual receive mental therapy to help them build skills for managing stress and regulating emotions. And sometimes medications may also be needed. Next, let's look at food. Can what you eat make a difference? Can food impact one's mood? Now, food alone isn't a cure, but it helps. A Mediterranean-style approach with plenty of vegetables and fruits, beans, whole grains, nuts, olive oil, and fish supports brain health and steadier moods. Cutting back on alcohol, excess caffeine, and ultra-processed foods also makes a difference. Think of food, movement, and rest as fuel for healing. Lastly, suicide is almost never about one single thing. It's many pressures at once. But the good news is prevention is possible. As family and friends, our role is simple but powerful. Notice the signs. Ask, stay, keep them safe, connect, and follow up. And if you are the one struggling, please know you're not alone. Treatment works and help is available right now at 988. Well, that's it for today.